stroke, memory loss, heart failure, three of the most feared health events in adults over 60. And all three of them can begin with something so small, so easily dismissed, that most people never connect the dots. A dry mouth when you wake up, not occasionally, not after a salty dinner, but every single morning, without fail, your mouth feels like a desert before your feet even touch the floor. Here is what nobody tells you. That dryness is not your body asking for water. In many cases, it is your body quietly warning you that something deeper has already begun. Something that has been building, perhaps for months, perhaps for years, while you simply reached for the glass on your nightstand and moved on. If you frequently wake up with a dry mouth, a thick tongue, or lips that crack before breakfast after the age of 60, this video was made specifically for you. I am Dr. Daniel Brooks, and joining me today on the Stronger Seniors podcast is Dr. William Carter, a physician who has spent 33 years in clinical practice, focused entirely on the long-term health of adults over 60. Dr. Carter has seen this symptom lead to discoveries that genuinely change the course of his patients' lives. Dr. Carter, in your 33 years of practice, why does morning dry mouth deserve far more attention than most people, and frankly, most doctors, give it?
Daniel, that is exactly the right place to start. Because the first thing I tell every patient who mentions this is the same thing I want to say to everyone watching right now. Saliva is not simply moisture. It is not water with a fancier name. Saliva is one of the most sophisticated biological fluids the human body produces. It carries enzymes, antimicrobial proteins, minerals, and immune compounds that defend your teeth, your gums, your digestion, and your bloodstream around the clock every single hour you are alive. And here is the number that stops most people in their tracks. After the age of 60, the body already produces roughly 30 to 40% less saliva than it did in your 40s. That reduction alone creates real vulnerability. But when it combines with even one of the 7 causes we are going to discuss today, that morning dryness stops being an inconvenience and starts being a message your body is sending you. A message that, in many cases, can be acted on before anything serious develops. And what concerns me most as a clinician is this. Research supported by the American Dental Association and published findings from the National Institute of Dental and Craniofacial Research have shown that chronic dry mouth in adults over 60 is associated with a 45% higher risk of systemic infection. Because saliva is your mouth's front-line immune defense. When it is gone, bacteria, fungi, and in some cases viruses gain a more direct path into your bloodstream. So when a patient mentions dry mouth, I do not reach for a prescription. I start asking questions. Because in my experience, what is causing that dryness almost always points to something deeper happening inside the body.
That is genuinely sobering, Dr. Carter. 45% higher risk of systemic infection from something most people dismiss as minor. And you mentioned 7 causes. Before we go through them, I want to ask you this. How long does someone typically live with this symptom before they even mention it to a doctor?
That is a question that honestly troubles me. In my practice, the average patient has been waking up with a dry mouth for over a year before they bring it up, and many of them only mention it as an afterthought, almost as they are walking out the door at the end of an appointment about something else entirely. They say, almost apologetically, "Oh, and my mouth is always dry in the morning. Is that normal?" And my answer is always the same. It is common. But common and normal are 2 very different things. Today we are going to go through all 7 causes, from the least serious to the one that concerns me most. And by the time we finish, you will know exactly what to watch for, what questions to ask your doctor, and what you can do differently starting tonight. Because here is what I want every person watching to understand. You are not broken. Your body is communicating. And what we are going to do today is teach you how to listen to it. Daniel, the answer most people never hear is this. Saliva is not water. It is your body's first line of immune defense. It carries enzymes, antimicrobial proteins, and compounds that protect your bloodstream around the clock. After 60, your body already produces 30 to 40% less saliva than it did in your 40s. That reduction alone creates real vulnerability. And a finding supported by the National Institute of Dental and Craniofacial Research confirms that chronic dry mouth in older adults is associated with a 45% higher risk of systemic infection. So when saliva disappears, the gates open.
That is remarkable. Now, Dr. Carter, you mentioned 7 causes. Most people assume the number one culprit is simply sleeping with their mouth open. But you told me before the show that mouth breathing is almost never just a habit. What is actually driving it?
Exactly right. Mouth breathing during sleep is almost always a symptom of something else, most commonly nasal congestion, a deviated septum, or sleep apnea. And sleep apnea is not something to wave away. Research published by the American Academy of Sleep Medicine shows untreated sleep apnea is linked to a 60% increased risk of stroke and a 40% increased risk of heart failure. If you snore, wake up unrested, or your partner has noticed you sometimes stop breathing at night, please talk to your doctor about a sleep study. That one conversation could matter more than you realize.
Now, here's one that surprises people. You told me that millions of older adults are actually making their dry mouth worse every single night by doing something they believe is helping. Dr. Carter, what is that surprisingly common mistake?
Drinking a large glass of water right before bed. I know. It sounds completely logical. But here is the problem. Your body takes between 30 minutes and 2 hours to absorb and distribute that fluid to your tissues. By the time it reaches your salivary glands, you are already deep asleep and still dry. The fix is simple, but almost nobody does it. Front-load your hydration in the afternoon, ideally before 5 in the evening. Think of it this way. You would not fill up your gas tank after you have already parked for the night. Same principle. And honestly, your bladder will thank you too.
Dr. Carter, you mentioned that causes 5 and 4 involve something happening deep inside the body that most people never think to check. What is cause number 5, and why does it catch so many people off guard?
Cause number 5 is nutritional deficiency, specifically zinc and vitamin A. Most people think of these as energy nutrients, but both zinc and vitamin A directly regulate how your salivary glands function. After 60, your body's ability to absorb zinc from food drops significantly. A study published by the American Journal of Clinical Nutrition found that zinc deficiency is present in nearly 40% of adults over 65, and one of its earliest signs is reduced saliva production. The fix is often straightforward once it is identified, but it almost never gets identified because nobody connects a dry mouth to a vitamin level.
That is eye-opening. Now, cause number 4 surprises almost everyone. You told me that millions of older adults have acid silently damaging their salivary glands every single night without feeling a single symptom. How is that even possible?
This is what I call silent GERD, gastroesophageal reflux disease. In younger adults, reflux usually announces itself loudly with heartburn and chest discomfort, but after 60, the nerve sensitivity in the esophagus often decreases. So acid moves upward during sleep and the person feels absolutely nothing. Meanwhile, that acid is irritating the ducts of the salivary glands night after night, gradually reducing their output. A study from the American College of Gastroenterology, published in 2019, confirmed that silent nocturnal reflux is significantly underdiagnosed in adults over 60. Here is what nobody tells you about this one. The first clue is often not heartburn at all. It is a dry mouth and a slightly bitter taste every single morning. So if you wake up dry and bitter, do not just reach for water. Think about what might be traveling upward while you sleep.
Dr. Carter, you mentioned that cause number 3 affects 4 million Americans, yet the average patient waits nearly 3 years for a correct diagnosis. What is this condition, and why does it hide so effectively from doctors?
It is called Sjogren's syndrome. It is an autoimmune condition in which the immune system mistakenly attacks the body's own moisture-producing glands, primarily the salivary glands and the tear glands. The result is persistent dry mouth, chronic dry eyes, difficulty swallowing, and in more advanced cases, joint pain and fatigue. Women over 60 represent nearly 90% of diagnosed cases. The reason it hides so well is that each symptom gets treated in isolation. The dry mouth gets dismissed as aging. The dry eyes get blamed on screen time. The joint pain gets labeled as arthritis. No single physician connects the dots, and the underlying autoimmune process continues unchecked. I treated a patient, a woman named Patricia, 73 years old, a retired school teacher from Virginia. She had been managing dry eyes with drops and dry mouth with mints for over 2 years. It was only when I asked whether both problems had started around the same time that everything clicked. A simple blood test measuring two specific antibodies, anti-SSA and anti-SSB, confirmed Sjogren's syndrome within 1 week. She looked at me and said, 2 years. 2 years I thought I was just getting old. And I told her what I want everyone watching to hear right now.
Dr. Carter, for someone watching who suspects this might be them, what is the one specific thing they should say to their doctor at their very next appointment?
Ask specifically, by name. Say these words: I would like to be tested for Sjogren's syndrome. Can we check my anti-SSA and anti-SSB antibody levels? Do not wait for your doctor to suggest it. In my experience, most general practitioners do not think of Sjogren first. You have to bring it to the table yourself. And while you are waiting for answers, sugar-free gum containing xylitol is one of the most accessible tools available without a prescription. It stimulates saliva production and simultaneously protects your teeth. Small step, real relief.
Dr. Carter, you said cause number 2 is the one that honestly keeps you up at night as a physician. That is a powerful statement from someone with 33 years of experience. What is it?
It is autonomic nervous system dysfunction, and it is a recognized early feature of both Parkinson's disease and Lewy body dementia. Here is what makes this so important. The parasympathetic branch of the autonomic nervous system directly controls salivary gland activity. When that system begins to deteriorate, saliva production drops. And research published in the journal Brain in 2017 confirmed that these autonomic changes can appear 4 to 6 years before the classical motor symptoms that typically lead to a Parkinson's diagnosis. 4 to 6 years. That is an enormous window for early intervention if someone is paying attention.
Dr. Carter, you treated a patient whose dry mouth turned out to be an early warning of something far more serious. Can you share that story? Because I think it will stay with every person watching today.
His name was Thomas. 79 years old, a retired engineer from Pennsylvania. Quiet, methodical, the kind of man who noticed everything but said very little. He had mentioned a persistent dry mouth across 3 separate visits. We worked through the obvious causes: medications, sleep position, hydration. Nothing fully explained it. Then, during one appointment, his wife mentioned almost in passing that Thomas had stopped recognizing the smell of his morning coffee about 6 months earlier. He had noticed it too, but said nothing, assuming it was unrelated. It was not unrelated. Loss of smell is one of the earliest documented signs of Parkinson's disease. I referred him to a neurologist immediately. Imaging confirmed early Parkinson's. Because we caught it early, Thomas was able to begin neuroprotective therapy and build a care plan well before significant symptoms developed. He told me recently, I almost did not mention the dry mouth. I thought it was too small. Nothing is too small. Your body does not waste signals.
Dr. Carter, we have arrived at cause number 1. The one hiding in plain sight in almost every home over 60. You told me this is the cause most consistently overlooked, most poorly communicated, and the one that genuinely angers you as a physician. What is it?
It is medication. Specifically, the cumulative effect of multiple medications that block acetylcholine, a key neurotransmitter that controls salivary gland function. This is called anticholinergic burden. Over 500 commonly prescribed medications list dry mouth as a side effect, over 500, and adults, over 60, take an average of 5 or more prescriptions daily. The drug classes most responsible include antihistamines, antidepressants, certain blood pressure medications, bladder medications, and muscle relaxants. Individually, the drying effect may be mild. But stacked together, the cumulative impact on salivary function and on brain health can be profound. Multiple large studies, including research published in JAMA Internal Medicine in 2019, have linked high anticholinergic burden to accelerated cognitive decline and significantly elevated dementia risk. The dry mouth is not the endpoint. It is the visible signal of something happening much deeper.
Dr. Carter, you once told me about a patient whose entire mental clarity improved simply by changing 2 medications. Can you share that story? Because I think it will genuinely shock people.
His name was Gerald, 77 years old, retired from Connecticut. He described waking up every morning feeling like his mouth was full of sawdust. He had been on the same medication combination for years. No single prescribing doctor had ever reviewed the full list together. When we did a complete medication reconciliation, we identified 2 drugs with overlapping anticholinergic effects, both of which had safer alternatives available. We made 2 substitutions. Within weeks, the dry mouth improved significantly. Within 2 months, Gerald told me something I will never forget. He said, "Dr. Carter, I wake up feeling like myself again, and I can think clearly for the first time in years. That was not coincidence. That was chemistry. And here is what nobody tells you. Most patients never get that conversation because no one ever looks at the full list. You have to ask. Write down every single medication you take. Bring that list to your doctor and say these words. Can you review my full list for anticholinergic burden? That one question could change everything."
Dr. Carter, we have covered all 7 causes. Before we close, what is the one action plan you would give every person watching starting tonight?
5 simple steps. Tonight, try a nasal strip across the bridge of your nose. It costs almost nothing and may dramatically improve how you breathe during sleep. Starting tomorrow, shift your main hydration to the afternoon, before 5 in the evening. This week, write down every medication you take and ask your doctor specifically about anticholinergic burden. If your mouth is dry and your eyes are consistently dry as well, ask your doctor by name about Sjogren's syndrome and request the anti-SSA and anti-SSB blood test. And finally, if you have had a persistent dry mouth for more than 3 months alongside any change in your sense of smell, please mention both to your doctor at your very next visit. Your body's been communicating this whole time. Now you know how to listen.
Dr. Carter, as always, this conversation has been genuinely eye-opening. 33 years of wisdom shared in a few minutes. I think I speak for everyone watching when I say we are grateful you are here. Now, if today's conversation helped you, do this one thing right now. Hit that like button so more people over 60 can find this information when they need it most. Drop a comment below and tell us where you are watching from today. We love hearing from our community across the country. Share this video with someone you care about, a friend, a spouse, a sibling, because you may just hand them the one piece of information that changes everything. And if you have not subscribed yet, hit that subscribe button and ring the bell so you never miss our next conversation on the Stronger Seniors podcast. Before we say goodbye, I want to leave you with a little brain challenge today. Because keeping your mind active and curious every single day is one of the best things you can do for your long-term health. So here's your question for today. We discussed that after the age of 60, your body produces significantly less saliva than it did in your 40s. Based on what Dr. Carter shared today, approximately what percentage less saliva does the body produce after 60? And here's the bonus part. Name one specific health risk that increases when saliva production drops that most people would never connect to their mouth. Leave your answer in the comments below. There are no wrong answers here, only opportunities to learn from each other. And we will be reading every single one. We are honored to be part of your health journey. This channel is for educational purposes only and is not a substitute for professional medical advice. Always consult your healthcare provider before making health-related decisions. We will see you in the next episode.